Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us today is Dr. André Corriveau, Deputy Chief Medical Officer of Health for the province. Dr. Corriveau will provide a brief update, and then we will open the floor to questions.
Well, thank you, Tom, for this introduction, and I have the privilege of serving as the Alberta's Deputy Chief Medical Officer of Health on a temporary basis. And I'm very pleased to stand in for Dr. Inshaw, who's taking some well-deserved free time with her family this week. Well-deserved. And so the good news that I have to bring today is that we continue to see the decline in our numbers of COVID cases on a daily basis all across Alberta. Over the last 24 hours, we've identified 127 new cases of COVID-19 and completed more than 4,400 tests. Our positivity rate has declined to about 2.9%, and we've identified 85 additional cases of variants of concern in these last 24 hours. Right now, we're just over 2,800 active cases province-wide, which is the lowest that it's been since October 15 of last year. There's currently active outbreaks or alerts in 216 schools, which represent 9% of all the schools in the province. Hospitalizations continue to decline as well. There are now 271 people being treated for COVID-19 in the hospital, including 68 in the ICU. Sadly, we had 4 new deaths reported to Alberta Health in the last 24 hours. So I offer my sincere condolences to the families and the friends of these individuals. As of June 13, we had administered more than 3.4 million doses of COVID vaccine to Albertans, including 46,000 yesterday alone. Over 69% of Albertans over the age of 12 have now received at least 1 dose, and 22% are fully vaccinated with both. So we're getting very close to our objective of 70%. The Open for Summer lottery that was announced yesterday is one additional way to bring us closer to the goal of collectively returning to a more normal life. And I hope it will inspire even more Albertans to get vaccinated over the coming weeks. The more people who get their shot, the stronger the protection we will all have collectively in the weeks and months ahead. If you have not already booked your shot, please do so as soon as possible. You can book at participating pharmacies, through AHS Online, or by calling 811. There are even walk-in vaccination clinics that are opening across Alberta waiting for you. Today, I would like to take a little bit of time to talk about vaccine safety and supply. If you're still unsure of whether to get vaccinated or are worried about vaccine safety, I encourage you to arm yourself with accurate information. Vaccines are safe, effective, and they do save lives. In Canada, we benefit from a thorough scientific review process for safety, efficacy, and quality. Within Canada and Alberta, we also have a robust surveillance system in place that monitors adverse events. To date, we have had 559 adverse events reported to Alberta Health, which represents roughly 0.015% of all people who've been vaccinated who've experienced an adverse event. And most of these were mainly minor symptoms such as pain, headache, mild fevers, and severe adverse reactions have been exceedingly rare. With the global experience now, when we look around the world of, where hundreds of millions of doses have been given, the experience of these vaccines really reassure us that we're offering something that will protect you, not only just protect you, but is safe to receive for yourself and your loved ones. And we are constantly watching the global experience as we analyze the data that comes to us on a nearly daily basis from across Canada and around the world. If you continue to have some concerns related to the vaccine, please seek out credible sources like a healthcare professional that you trust or a loved one who's already received their vaccine, and ask those questions. And then hopefully you will be ready to go and register for your first dose. And once you've received the first dose, it will be important then to start thinking about the second one, because the second one is what will give us a sustainable recovery from this pandemic experience. One thing I've learned over my experience as a public health officer is that small steps taken collectively can make a huge difference for the benefit of everyone. We're incredibly fortunate to have vaccines that are as effective as they've turned out to be, because certainly at the beginning we didn't know where we would be landing in this area. After 2 doses of the Pfizer or the Moderna vaccine, we are noticing really fabulous effectiveness, in the 90% range. And even against the new variants of concern, after people have had their 2 doses, there was new data that came out of the UK today that showed, with Pfizer 2-dose, 88% protection plus against the new Indian variant, the Delta variant. So these are really good news that we should use to comfort ourselves that we're headed in the right direction. The second dose is really critical to consolidate the gains. So we are hoping to maintain the momentum, and we're working really hard to find ways to accelerate access to the second doses to all Albertans so that we get to our goal as soon as possible. I know also that some Albertans who've received the Moderna or the Pfizer vaccine for their first dose have been wondering whether it matters which type of mRNA vaccine they receive as a second dose. Both Pfizer and Moderna use the same mRNA technology, and they're considered now to be interchangeable. Even though there's not a lot of solid evidence in this regard with regard to those particular 2 vaccines, we in public health have a lot of experience interchanging vaccines made by different companies. With regard to, sometimes when one vaccine is no longer available, there's a shortage, we've substituted a lot of the childhood vaccines, the hepatitis vaccines, so we have a lot of experience. And recently, the National Advisory Committee on Immunization has stated that regardless of which vaccine you receive for your first dose, it is safe to receive a different one for your second one. So whichever vaccine you receive, be confident that you're receiving great protection in a safe way against the virus. We all want to move on from this pandemic as soon as possible, and the only way to do that sustainably will be for as many people as possible to build full immunity against the virus. Vaccines have that power to eradicate disease, but only if we work together to put them to good use. In the meantime, please keep safe, follow the rules, and protect each other for just a little while longer, because we're very close. Thank you very much, and I'll be happy to take questions from everyone.
All right, we'll now open the floor to questions. We'll start in the room here.
Hello, Lauren Boothby with Edmonton Journal here. I'm just wondering if you can talk about the Delta variant in Alberta. It looks like we've had about double the amount of cases in a week. Are we concerned about it growing, or are we more thinking it's going to be staying confined to that outbreak in Calgary or staying in Calgary?
Well, we are certainly very concerned about the Delta variant and where it might go. It has shown itself to be a lot more transmissible than the other, even the other variants that we've experienced to date. But I think the good news is one, like I mentioned today from the UK data, is that the vaccine, when people have received 2 doses, is still very effective. The other thing is, as our numbers decrease, overall, a more transmissible variant will normally or naturally become predominant just by default because it spreads more easily within households or in the certain types of setting among non-immunized people. So really at this point, we're staying focused on not only the number of people who are getting their first and second dose, but our declining numbers. We're watching and certainly trying to do all we can still with the public health measures in place to contain it in the Calgary area. We are still confident that our strategy is aimed in the right way to get as many Albertans immunized as possible as soon as possible.
Lauren, is there a follow-up question?
Yeah, a number of health organizations and jurisdictions have talked about COVID being airborne, but I haven't heard anything about that from Alberta Health. Do we know that it's airborne, and how does that knowledge put any potential reopening at risk or make different activities more risky because it's being spread through the air? Can you just talk about what we do know on this?
Well, I think that there is certainly some evidence that the COVID virus can be airborne, but we don't still have a lot of evidence that it's a major form of transmission. I think when we observe the large outbreaks that we see in different settings, it's usually where people are congregating in large crowds or in close family gatherings where there's a lot of people that are close together, and so it's not like we're ruling out the possibility. It's just that it still doesn't seem to be a major form of transmission, and it's something that we continue to watch.
All right, we'll go to the phone now. Operator, could you put through our second caller, please?
Kevin Nimick, CTV.
Hi, Dr. Corriveau. What's your advice for travel within Alberta right now?
Well, we still are recommending until we move to phase 3 to limit your travel to what you feel is necessary. We I think certainly if you have to travel and you're following the public health advice, that it's certainly getting increasingly safe to do so, but we're still asking people to abide by the current measures just a couple more weeks longer, if possible, because this is where we need to be.
Kevin, is there a follow-up question?
Yeah, you said to limit your travel to what you feel is necessary, but what does that actually mean? Like, for example, is it advisable for me to go for an overnight stay in Banff this weekend?
I would think, if you, we're just still suggesting that people, minimize their unnecessary travel, but if there's a reason why you want to go to Banff, I think it's quite appropriate if you're following the public health measures, and abiding by the rules with regard to masking and the limits that have been placed in restaurants and other types of activities.
Operator, could you put through the next caller, please?
Jenna Freeman, Global TV.
Hi there. Thanks for taking my question. Just wondering, is there any other benchmark other than that 70% that's being considered as we approach stage 3 possibly becoming more of a reality? And what is it?
Well, we're certainly, in the benchmarks, we had included also, the level of disease activity overall and, the hospitalization rates. So, but certainly the main one is the immunization rate because we know it works and we know it's going to have a major impact.
Jenna, is there a follow-up question?
No, thank you.
Operator, could you put through the next caller, please?
The next question comes from Dylan Short, Post Media.
Hi there. My question is in regards to that 70% as well. There's been a few healthcare professionals, as well as I believe your counterpart there, Dr. Tam at the national level, who have I guess issued warnings about the Delta variant, saying maybe we have to be even higher and get up more second doses before lifting public health restrictions, or we risk a fourth wave. I'm curious, what does the provincial data show in terms of a fourth wave if we don't wait for more second doses to be administered?
Yeah, so we're starting to do some work on on modeling, and really the key is how quickly we will be able to get the second dose completed in as many people as possible over the coming month. So there's a huge difference in terms of whether we can avoid completely a fourth wave, or to what extent we might experience a fourth wave in the early fall. It will really depend on how many people by then have achieved their second dose. I think even last summer there certainly appears to be some seasonality to COVID-19. Last summer, even without vaccine available, we saw large reductions in transmission of the virus and the rate of illness. So right now, the circumstances, we have the vaccine on top of that, and we think we can achieve our goal of avoiding a significant fourth wave by reaching high levels of second dose in people who've received their first dose.
Dylan, is there a follow-up question?
Yeah, given that the latest information available shows that the second dose is much more effective against these variants of concerns, especially the Delta one. Is there any discussion at this time of moving up the availability for individuals that got their first dose in May? We saw that initially for people in April, that date was moved up by a few days. Are we looking at moving up that date from that June 28th, I believe, was the initial day when people could who got their first shot in May?
Yeah, absolutely. I have already mentioned that briefly, but we are looking at the arrivals. We received the information that we will get an increased allocation of Moderna vaccine in the next couple of weeks. So we're doing the math right now to be able to speed up the access to a second dose as much as we possibly can. And we hope to be able to make an announcement later this week about when that will occur.
Operator, could you put through the next caller, please?
Brianna Carson-Smith, Global News.
Hi, doctor. Thanks for taking my question. I'm wondering what the uptake of second doses has been so far. Are you seeing it match the number of people who are wanting that first dose? Are they actually returning for their second?
Well, we've already achieved over 22% of people who've already received their second dose. And we know there's a lot of pent-up demand because, we get the phone calls at Alberta Health Services on the call line. The pharmacists tell us that people are stomping at, they want to get their second dose, but we wanted first to make sure that we would, prioritize the first dose. I think we feel more comfortable with the stability of supply and the increase in supply that's expected in the next few weeks to open up access to the second dose as quickly as possible.
Brianna, is there a follow-up question?
Yeah, can you tell me where the spread of the Delta variant is actually happening? Are we seeing it sort of within family members, or where are people contracting that?
Yeah, like I said earlier, we did have it is a virus that transmits a lot easier, probably twice as easy as even the old British variant that had become our normal variant here in Alberta. And so it can, within a household, it can spread very quickly, and there's been cluster outbreaks in other. But at this point, we still have the means to with the existing public health measures and the isolation and quarantining of contacts, we feel that we have the capacity, because the numbers are still low, to contain this, and while people are moving on to have their second dose.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Jennifer Lee, CBC.
Thanks for taking my question. We've spoken with a scientist who's modeled the Delta variant and is predicting that it could take over as Alberta's dominant strain by the end of June that it is kind of quietly sparking a fourth wave as the overall case counts go down, similar to what we saw with B117. So I guess I'm wondering, you kind of touched on modeling earlier, but specifically, what does Alberta Health's internal modeling show about when Delta will take over as the predominant strain? And can you give us a sense of like how many daily cases of this Delta variant you guys are projecting by, let's say, early July, mid-July, late July? Could you give us a sense of that, please?
Yeah, I don't think we've done that modeling yet. It's work that's in progress, so we can certainly provide some of that assessment at a later, maybe media availability this perhaps Thursday or early next week. I can't tell you for sure, but I just want to say again, I want to repeat the fact that because this variant is a lot more transmissible than the ones that we have experience with at this point, as our numbers decrease, it's likely that it will become dominant. But if the numbers are really low, then it's not as big of an issue. Even though it is if it becomes dominant, if we're only seeing 10, 25 cases a day, that's quite different than when we're seeing 25,000, 2,500 cases a day. So it's really we have to take that into context as well. I heard one of my provincial colleagues was mentioning that they're seeing mostly the Delta variant, but if you only have, if you're a small province and you only have a few cases, then it's not as big of a deal than if you have you're in the middle of a big wave.
Jennifer, is there a follow-up question?
Yeah, thank you. Calgary appears to have the lion's share of the Delta variant cases. Do we have a sense of why that is? What some of the reasons for that might be, and what's your level of concern about what's happening with that transmission in Calgary right now?
Well, we're concerned, like the spread in any case. We have concerns about this variant because we still have to accelerate the second dose, but at the same time, the numbers are still at a level that we feel comfortable to be able to manage. And most of the transmission, from my understanding, has been within households. So again, it's about ensuring that our closely knit groups. So we have to work to limit its spread as much as we can.
Operator, could you put through the second last caller, please?
Adrienne Williams, CBC French.
Bonjour, Monsieur Dr. Corriveau. J'aurais deux questions en français. Elles ont déjà été posées, mais je vais les poser en français. Où est-ce qu'on en est dans l'accélération de la distribution des deuxièmes doses de vaccins? Vous avez mentionné que cette semaine, il y aurait peut-être une annonce qui serait faite à ce niveau-là. Donc, où en est la province avec ça en ce moment?
Bon, alors, ce que j'ai dit tout à l'heure en anglais, on a déjà 22% de la population qui a reçu une deuxième dose. Puis, on espère pouvoir accélérer l'accès à la deuxième dose d'ici quelques jours. Alors, on voulait juste confirmer les arrivages. On voulait continuer à prioriser la première dose, s'assurer que tous ceux qui ont besoin ou qui ont pris un rendez-vous pour une première dose seraient prioritaires. Mais on espère pouvoir accélérer très bientôt. Puis comme j'ai dit, on pense pouvoir faire une annonce plus tard cette semaine.
Is there a follow-up question?
Yes. Est-ce que c'est réaliste de dire qu'on va pouvoir éviter une quatrième vague à l'automne, surtout en considérant la présence de variants comme le variant Delta en Alberta?
Alors, ce que j'ai dit tout à l'heure aussi, c'est que les modèles démontrent que tout va dépendre de comment rapidement on peut augmenter la proportion de personnes qui ont reçu une deuxième dose. C'est évident que le virus de la COVID, il fait partie de notre écosystème maintenant. Alors, un peu comme l'influenza ou d'autres virus respiratoires, il va y avoir probablement toujours un certain niveau d'activité. Ce qu'on va devoir continuer à faire, c'est s'assurer que les gens les plus vulnérables sont immunisés puis sont protégés adéquatement. Qu'on maintient certaines des bonnes habitudes qui ont été acquises au cours de l'année et demie qu'on vient de passer, comme rester à la maison quand on ne se sent pas bien, se laver les mains et éviter les situations où si on a la possibilité d'avoir le virus, de ne pas le propager à d'autres personnes.
Operator, could you put through our final caller, please?
Chris Bargo, Calgary Herald.
Hi, Doctor. I'm wondering if you can elaborate a little bit with regards to Phase 3 and what, or if any, restrictions will be in place for businesses once the Phase 3 is introduced. In other words, will there still be any kind of requirements for social distancing within fitness studios, or will restaurants still expected to have some tables be left empty, or are all of those restrictions going to be removed? If you can provide any clarity on that, it would be helpful.
Well, I don't have all the details, but I think the main focus, I think the key message in Phase 3 is that we want to put some responsibility back on Albertans. So the mandatory measures with regard to masking and distancing are going to be removed. So there, but there's, like I was just mentioning in French, some of those good habits that we have acquired over the past year and a half are still important to maintain in terms of, don't go to a public event or even to work if you're not feeling well. Observe respiratory etiquette. If you're in we expect that some settings where there's a lot of high-risk people, it might still be appropriate to continue wearing a mask if you're visiting an elder in a long-term care facility, because we know vaccines are, a little bit less effective in that, frail elderly. There's certain things that will need to continue, but we don't plan to mandate it anymore. We are, wanting people to look at what is reasonable to continue doing and what we can, and how much of the regular life we can continue, resume for ourselves collectively.
Chris, is there a follow-up question?
Yeah, sorry, but just to be clear here, will there be industry-specific rules or regulations that will be required at that time, such as, for instance, empty tables within restaurants, or is that going to be removed entirely?
I don't remember. I don't think so.
We can follow up with you offline, Chris. André Corriveau does not have that answer readily available. Thank you all for joining us. Dr. Corriveau will provide another update later this week. Have a safe evening.